Good day, everyone. I'm excited to see you watching this video this morning. And in this video, I'll be taking you through a health program. This health program is a weekly program organized by His Grace Medical Diagnostics, and it is tagged you and your health. First of all, I would like to introduce myself. I am Tayo Oyekale by name. I am the CEO of His Grace Medical Diagnostics. And in this video, I will be teaching you about diabetes. I know diabetes is not a new topic. You might have heard about it before, but today I will be dissecting it to you. I'll be talking about diabetes, causes of diabetes, signs and types of diabetes, signs and symptoms of diabetes, and what to do to know if you have a diabetes. And one thing I want you to know is this: you must never joke with your health. One of those things you must never joke with is your health, because if you are in good health, you have a good life. You can only achieve all your dreams when you are in good health. And that is why His Grace Medical Diagnostics is bringing this health program opportunity to you. Now, let's go straight to the point. What is diabetes? Diabetes is a disease condition that involves a high sugar in the body. Diabetes is a disease condition that involves high sugar level in the body. I want to make it so simple as possible. Now, what causes diabetes? Diabetes can be caused by three things, or by three major factors. Number one, when insulin is not produced enough in the body. Now, let me explain very well. Anytime you eat your food, your carbohydrate food, or you take a drink, the food you ate is being broken down to sugar in form of glucose. And this glucose is needed by the body cells in the body. So when you eat the food and the food is broken down to glucose, it will move into your bloodstream. Now, inside the body, there is something I call pancreas. And pancreas secretes what I call insulin. Insulin is an hormone. This insulin activates the bloodstream and makes the bloodstream to transport the glucose to the body cells where they are needed. I mean, body cells such as heart, liver, brain, and other organs in the body. But if the insulin is not produced enough, which is one of the factors, now insulin, sugar can be deposited in the bloodstream, and when it becomes so higher, it causes what we call diabetes. Apart from inadequate production of insulin by the pancreas, another factor is that it's non-production of insulin in the body. Now, if insulin is not produced at all in the body as a result of malfunction or malformation of pancreas, or as a result of destruction of pancreas, now this can also cause diabetes. And number three is that if insulin is produced, but there's a resistance to insulin by the body cells, so insulin resistance by the body cells can also cause a lot of sugar to be deposited in the bloodstream, thereby causing diabetes. So, in a nutshell, diabetes can be caused by low production of insulin by the pancreas. Number two, non-production of insulin by the body as a result of probably destruction of pancreas or autoimmune reaction causing the destruction of pancreas. Then number three is insulin resistance by the body cells, thereby affecting production of insulin. Now, let me quickly talk about the types of diabetes. Now, the first thing is type 2 diabetes. This one is common among 90% of people having diabetes, and it can be caused by the three factors I mentioned earlier: non-production of insulin, low production of insulin, and also the resistance of insulin by the body cells. Then number two is prediabetes. Prediabetes is a condition whereby someone is having high sugar in the body, but the person has not been diagnosed for diabetes. Now, the person is having high sugar in the blood, but the blood sugar level is not higher to be recognized as diabetes. Then number three, we have type 1 diabetes, and this is an autoimmune disease condition whereby your immune system is destroying the pancreas, thereby hindering insulin to be produced. Then number four is type 3C diabetes. Now, type 3C diabetes is a condition whereby the pancreas is being destroyed. The pancreas has been destroyed, maybe as a result of cancer, as a result of tumor, or as a result of surgery. The pancreas has been removed, thereby causing about what we call diabetes. Now, apart from that, we have gestational diabetes. This is common among pregnant women. There are some pregnant women that have high sugar during the pregnancy, but immediately after giving birth, the diabetes disappear. Now, such a person must be careful because this person can eventually have a type 2 diabetes at the later stage. And the last one is neonatal diabetes. This is common among the neonates. In the first 6 months of a newborn baby, the baby will be having high sugar level. Now, after talking about the types of diabetes, now let's talk quickly on signs and symptoms of diabetes. Number one, the person can be having increase in thirst. Now, the person can be feeling thirsty every time. Now, if you are feeling thirsty at all time, then you may be having diabetes. The number two is frequent urination. The person will be urinating frequently. In fact, I know of someone that used to urinate up to 10 to 15 times before morning. Anytime he sleeps, he will urinate for up to like 10 to 15 times. And this person is a diabetic patient. So frequent urination is also a sign and symptoms of diabetes. Then delay in healing of wounds and cuts. Now, if you're having cuts or wounds and for a long time there's a delay in healing, then it may be as a result of diabetes. Another one is blood vision. The person will not be able to see clearly. Apart from blood visions, now the person can be having numbness. Now, numbness is a condition whereby the person, you don't feel sensation or pain in your body. Apart from numbness, the person can be having frequent skin infection or frequent vaginal yeast infection by women. These are signs of diabetes. The person can be having weakness or tiredness. You are just feeling weak without any reasons. This can be as a result of diabetes. And apart from weakness and tiredness, the person can be having unexplained weight loss. These are signs and symptoms of diabetes. Now, diabetes needs to be taken care of, because if you don't take care of it, you can start having the complications. And what are the complications of diabetes? Number one I'll talk about is heart disease problem. That's coronary. The person can be having coronary heart disease problem. Paralysis, stroke is also part of the complication of diabetes. The person can be having kidney problem, which I call nephropathy. Apart from kidney problem, the person can be having what we call sexual dysfunction. Now, some people, a man that cannot perform well enough as a man. Now, your private organ is not erect as it ought to be. Now, you may be having erectile dysfunction. Diabetes can cause this. This can also occur in a woman. So, sexual dysfunction, the person will not be able to perform well in sexual activities. This is complications of diabetes. Another complication is that the person can be having eye problem. In fact, loss of sight. The person can lose sight, can lose their eyes. Now, apart from that, now person can be having loss of nerves. The person can lose senses. The nerve cells can become damaged, and the person will not respond to any sensory sensations. And the most dangerous thing is that the person can become depressed, and as a result of depression, the person can have mental health problem, and lastly, it can cause the death of a person. Now, I've talked about different complications. So now, how do you now know if you're having diabetes? What are the diagnoses of diabetes? Number one thing you need to do is to do a laboratory examination. You need to do a laboratory examination. Now, there's some laboratory tests that you can do to be sure if you're having diabetes. Now, the first one that you can do is, number one is, you do fasting blood sugar, whereby you will fast overnight. You fast for 8 to 12 hours. That means you can eat like 9 p.m. in the night, and in the morning, like 7 or 8 a.m. in the morning, your blood sample will be collected for sugar examination. Apart from fasting blood sugar, you can do random blood sugar. This one can be done at any time. Your blood sample will be collected when you are eating, and it will be estimated for sugar level. Apart from random blood sugar, we also have what we call 2 hours postprandial test. Now, after the person have done fasting blood sugar, the health professional will tell the patient to go and eat, and after 2 hours of eating, another blood sample will be collected for sugar examination. Then, apart from that, we also have glycated hemoglobin test. Now, these people that do glycated hemoglobin test, they are already confirmed for diabetes, but they just want to monitor the result. They want to monitor the value. So the person will be asked to do the test. Now, apart from laboratory tests, other things that can be done for a diabetic patient is, after checking, after to know if you have diabetes, after doing laboratory examination, there are some other measures that can be done, and one of them is regular exercise. If you are having diabetic, or if you want to prevent having diabetic, do regular exercise. Another thing is that you need to avoid eating fatty food, anything having cholesterol, fatty things, because most of the fatty food, all the food we ate, even all the classes of food, all the food that we ate are being converted to sugar at the end. After it has been used by the body, they are converted to sugar by the body. So, and if these things are deposited in your blood and so much than the normal level, diabetes can result. So, avoid fatty food, avoid sugary sugary drinks, avoid that. Avoid smoking, avoid alcohol. These are measures that you can put into place to prevent diabetes. Now, if you want to know that you're having diabetes, then I will advise you to go for a laboratory test. Now, His Grace Medical Diagnostics can help you to do that. In our center at Araro, we can help you to diagnose if you are having diabetes or not. Now, if you are having diabetes, that's no problem. There are some drugs that you can take, and one of them is insulin therapy. You can be given insulin to reduce your sugar. Then you will be monitored. So all these things will help you out in that. We diagnose you for it, and also give you a professional health advice on what to do to avoid diabetes. Now, I've talked about diabetes. I've talked about complications. But having diabetes is not a good thing, and that's why you need to take care of yourself. Now, if you are ready to know your health status, then come to see us at EMS Plaza at Araro. Now, we are beside the petrol station at Araromi. You can contact us on 08104026313 or 09026935569. We are right there to attend to your health challenge. Thank you for watching this video. God bless you.